everyone, so let's move towards our today's topic, which is
Axilla is basically the connection between the head and neck, or the space, or the pathway, or the route for the vessels and nerves to enter into the arm, to enter into the upper limb. Axilla is also known as armpit. It is present beneath the glenohumeral joint, and it is filled with fat. It is the passageway or pathway of nerve and vessels of the upper limb. It is disappear when if you abduct your arm fully, it will disappear. Means अब आप अगर अपने हाथ को, अपने अपर लिम्ब को अपनी पूरी बॉडी के साथ अटैच कर लेते हो तो एक्सिला डिसअपियर हो जाता है. ओके, अनदर थिंग, एक्सिला इज बेसिकली a whole connection which is present between head and neck, neck and upper limb, but it is the area. Basically, it is the area. It is not an organ. It is a area. It is the location at which nerves and vessels are present. It consists of three parts: upper part, a lower part, and body. Upper part is also known as apex or inlet, and it is triangular, and it is also known as cervico-axillary canal. It is the uppermost part. Okay, and if you see my diagram in my notes, you can see easily that it is formed by थ्री बोन्स. ओके, अगर आप एक्सिला को ऊपर से देखेंगे तो आपको तीन बोन्स नज़र आएंगी जो एक्सिला की बाउंड्री बना रही हैं. नंबर वन, एपिक्स की बाउंड्री बना रही हैं. नंबर वन, जो एंटीरियर साइड पे बोन है वो है क्लेविकल, जो पोस्टीरियर साइड पे है वो स्कैपुला है, और जो मीडियल साइड पे है वो रिब्स है. अब आप सोच रहे होंगे लेटरल साइड पे भी कुछ होगा. नहीं, लेटरल साइड पे कुछ नहीं है. बेसिकली ये ट्रायंगुलर शेप के होते हैं, तो तीन बोन्स इनके इर्द गिर्द होती हैं जो आपस में कनेक्ट होते हैं, और बीच में जो स्पेस होती है वो फैट से फिल होती है, और उस स्पेस को ही एक्सिला कहते हैं. फिर अगर हम लोअर पार्ट की बात करें, जिसे फ्लोर भी कहते हैं या बेस भी कहते हैं, सो दैट विल कवर्ड बाय फेशिया. ओके, एंड इट इज़ प्रेजेंट एट द लेवल ऑफ फोर्थ रिब. अब इसका मतलब ये नहीं है, मैंने कहा ना फोर्थ रिब के लेवल पे प्रेजेंट होते हैं. इट डजंट मीन कि इट इज़ प्रेजेंट ऑन द रिब, इट इज़ प्रेजेंट एट द लेवल ऑफ रिब. मीन्स अगर आप रिब्स को देखो तो रिब्स की जो फोर्थ रिब होगी, फोर्थ रिब के बिल्कुल ठीक उसी की लाइन में ये फ्लोर या फिर बेस आप जिसे कह लें प्रेजेंट होगा एक्सिला का. Okay, now we will move towards we have to move towards the body of axilla. The body of axilla is basically consists of four walls: anterior wall, which is in the front; posterior wall, which is in the back; medial wall, which is present at the site of ribs; and lateral wall, which is present at the site of upper limb. First, we will talk about anterior wall, which is front wall, and it is covered by pectoralis major, pectoralis minor, and subclavius muscle. Posterior wall is covered by latissimus dorsi and subscapularis and teres major muscle. Medial wall is connected with or is present with serratus anterior muscle, and it is this wall is till the fourth rib or fifth rib maximum. फोर्थ till फिफ्थ रिब तक ये medial wall मौजूद होती है. ओके, now lateral wall is formed by bicipital groove or intertubercle sulcus, and it is covered by biceps and coracobrachialis. Okay, now what are the content, what are the vessels, what are the things which are present in axilla? सबसे पहले तो सबसे पहले तो फैट्स मौजूद होते हैं, देन वेसल्स और नर्व्स एंड लिम्फ नोड्स भी प्रेजेंट होते हैं. So first we will talk about vessels, which is axillary artery. Axillary artery begins from first rib to teres major muscle, and remember this shortcut for axillary artery, that pectoralis minor के पीछे से और teres major के आगे से. क्या? pectoralis minor के पीछे से और teres major के आगे से ये axillary artery पास होंगे. Okay, behind the pectoralis minor and above the teres major muscle, the axillary artery will pass. There are three parts of axillary artery. First part is from the first rib to the medial part of the pectoralis minor muscle, and second part is from medial to lateral part of the pectoralis minor muscle, or in other words, behind the pectoralis minor muscle. The part of axillary artery which is behind the pectoralis minor is the second part, and the third part is from the lateral part of the pectoralis minor to teres major muscle, and teres major के ऊपर से ये axillary artery pass होते हैं. Okay, now axillary vein. What is axillary vein? Axillary vein it is formed from subclavian vein, and it will form cephalic vein and brachialis vein. Now, what is brachial cords? I have already told you in the brachial plexus recording, but brachial cords are formed with on the second part of the axillary artery, the area at which second part of axillary artery is present, that area consists of brachial cords. Okay, what is axillary lymph node? It's a little bit lengthy topic, so remember, axillary lymph node consists of 5 groups. Okay, and I am telling you the main important points which you have to remember for the exam. Axillary lymph node, as you know what are lymph nodes, you know lymph, you know lymphatic vessels, you know everything about lymph. But what are axillary lymph node? Axillary lymph node are the lymph node which are present in axilla. Simple. It consists of 5. There are 5 groups of axillary lymph node. Anterior or pectoral group. Number 1 is anterior or pectoral group. It is present behind the pectoralis major muscle, and it drains mammary glands and upper part of the trunk of the anterior part of the body, and the posterior part of the body the posterior axillary lymph node is basically covered by subscapularis and drain upper part of trunk of the posterior side. Lateral group or humeral group, it is present on the axillary lymph node. It is present on the axillary vein, and it drain upper limb. Okay, so the group which drain upper limb is basically lateral group of axillary lymph node. What is central lymph group? Lymph group is basically the group which is collecting the lymph from other groups, anterior, posterior, and lateral group. The central group basically receiving the lymph from other lymph node, and then they will supply to the apical lymph node. Apical lymph node. What is apical lymph node? Apical lymph node is also known as infraclavicular lymph node, and it receives lymph from the central group. So guys, take care of yourself and study hard, work hard, and good luck. Bye.